Let's tell you now that at least 6 people have died in Malabu community, Fufore local government area of Adamawa State, following a suspected outbreak of Buruli Ulcer, a rare but devastating skin disease. The State Ministry of Health confirmed the fatalities, adding that no fewer than 67 confirmed cases were recorded, with 8 under admission in the Modibbo Adama University Teaching Hospital. And so we have one of our correspondents on ground to give us more details, Aishat Salihu. Aishat, can you tell us more about this latest outbreak?
Thank you so much, Lekon. Well, first of all, I'd like to state that we're in Malabu community at the moment, and upon getting to this community, you can tell that there is dilapidated road infrastructure. The road network to this community is really, really terrible. And upon getting to this particular primary healthcare facility, we have been speaking with affected individuals, families, persons who have come down with symptoms of this suspected Buruli ulcer. And also we met with officials of the State Ministry of Health, and they had just even departed from this facility where they brought some commodities and also came particularly to take a second sample. You recall that a couple of days ago they took the first sample, which was taken to the Nigeria Center for Disease Control and Prevention in Abuja, for histology to check what exactly is going on before they can then say, okay, this is what's happening and this is how to go about it. But we are not really sure of what happened to that particular sample that went to Abuja. Another one today has been taken. Earlier, officials from the Ministry of Health came and they met with those persons who have this diseases, who are presenting with the symptoms of these diseases, and they took these samples, hoping to take it back to the NCDC again in Abuja, as this community, even the whole of Yola, Adamawa State, does not have the facility to check for what is actually happening in the community. And it will surprise you to know that we have been speaking with most of the affected persons here, and they have been reeling out debilitating stories. Some of them are saying that they have been dealing with this particular condition right from last year. It's not something that even started today. Some have said over a year, some have said a couple of months, and they have had to, take on traditional methods of taking care and treating this disease. And this, with the presentation of this disease, is more like it comes with a boil at first, and then it spreads around the skin, and you can see it tearing the skin, eating up the skin. That is why some even initially termed it a flesh-eating disease, eating the flesh and even into the bone. We have seen some people here who who have those such cases. And another thing here that is of concern is that there is hesitancy in the community. We have spoken to health officials, and we have also spoken to members of the community who have this disease, and they mentioned that part of the issues they're facing is the low health-seeking behavior of the people in this area, where they're refusing to come to the healthcare facilities to get treated. I mean, you can imagine about 67 persons have been confirmed to have this disease, and only just 8 hospitalization, only just 8 in the hospitals, and even 6 have now died. So there is fear, there is tension, there is apprehension amongst the residents in this community about what is their fate. Because I have spoken with some of these people, and they mentioned that even though the government, the health officials are saying they are not sure if it's something that is transmitted, if it's communicable, but from what I have heard from these persons here who have this disease, they are saying that some of them, it was their family members who had it first, and later it moved on to them. And others, most of the people in this community are farmers. The Malabu is an agrarian community that shares border with Cameroon. So most of the people in this area, they farm. So this is what we have gathered so far.
Well, this is a very sensitive medical situation in Malabu. We hope that they get all the medical care that can be provided for them to help stem this outbreak in time. Thank you so much, Aishat Salihu, for sharing the updates with us.